If you have diabetes, it is important to be aware of the signs and symptoms that may occur in your mouth. Diabetes can cause a variety of oral problems, including gum disease, dry mouth, burning mouth syndrome, salivary gland dysfunction, geographic tongue, and that one is interesting, and candidiasis, a fungal infection. Now, in this video, I will show you the most common mouth manifestations of diabetes and provide tips for preventing them. By the way, I'm Dr. Ahmet Ergin. I'm an endocrinologist and a diabetes specialist. I practice in Florida, and yet I pretty much serve the entire world through these videos. Now, let's talk about number one, white coat on your tongue. What does it mean? Well, you may not know this, but your tongue can say a lot about your health. For example, a diabetic tongue is often covered with a whitish coating, and it may appear to be enlarged. This is because high blood sugar levels can cause changes in the way the body produces saliva, resulting in a buildup of yeast on your tongue. Diabetic patients are also more prone to developing other oral manifestations such as periodontal disease like gum disease, or dry mouth, or burning mouth, and salivary gland dysfunction. So if you notice any changes in your tongue, be sure to see your dentist or your doctor right away. If you have diabetes, you might find yourself feeling parched or extra thirsty as well. That's because studies have found that people with diabetes have typically less saliva. Medications and higher blood sugar levels are also a possible cause for dry mouth. So to fight a dry mouth, I would say, of course, drink lots of water. You can also chew sugarless gum and eat healthy, crunchy foods to get your saliva flowing. That's especially important because extra sugar in your saliva combined with less saliva to wash away the leftover food can lead to cavities. Now, keep your mouth hydrated and your teeth healthy, and drink a lot of water, eat a lot of healthy, crunchy fruits and vegetables. If you are ever feeling extra thirsty, reach for a glass of water instead of a sugary drink as well. Number two, taste changes. If you thought that diabetic nerve pain was the worst complication of the disease, think again. Diabetes can actually lead to taste disorders, also known as dysgeusia in medical terms. Now, what happens is that high blood sugar levels damage the taste buds, causing them to become less sensitive to sweet and salty and bitter flavors. In some cases, diabetic tongue can actually cause a metallic taste in your mouth. Now, while this is not a life-threatening condition, it can be extremely unpleasant and make it difficult for you to enjoy your food. If you're diabetic and struggling with taste disorders, again, talk to your doctor, talk to your dentist about that condition. Now, if you're liking this video so far, please subscribe and hit the bell icon, and remember to write a comment about your 2 cents on this topic. If you don't know where to write, look down, it's in the comment section. Number 3, oral thrush. Well, that's a little bit different than a white tongue, but I'm not talking about when you have eaten like too much candy or it coats the roof of your mouth with the yogurt or whatever, but I'm talking about a real actual yeast infestation. It's called thrush. Now, thrush is more common in people who wear dentures or diabetic and can often leave a pretty bad taste in your mouth as well. Now, the yeast thrives on the higher amount of sugar found in your saliva, and it looks like a white layer coating on your tongue and the insides of your cheeks. So if you have ever wondered why your tongue looks like cottage cheese, now you know. One of the many unfortunate side effects of diabetes is that it can take a toll on your immune system as well. Now, it's going to leave you more susceptible or vulnerable to the infections. Now, one common infection, again, among people with diabetes, unfortunately, is oral thrush. Now, how do you know you have oral thrush? Well, you will have the growth of that white fuzzy film on your tongue, which can be painful and difficult to remove. In addition to causing discomfort, oral thrush can also lead to bad breath. So not only do you have to deal with all the embarrassment of having a diabetic tongue, but you also have to worry about your breath smelling like a science experiment gone wrong. Fortunately, there are treatments available that can help to clear up the thrush and improve your overall health. Number 4 is a salty taste in your mouth. If you have a chronic taste disorder, you may discover that dry mouth is the cause of that salty taste in your mouth. A diabetic tongue can often lead to a loss of moisture in your mouth, which can then create a residue of salt on your tongue. This can give a false impression that your mouth is constantly filled with a salty taste. In addition to dry mouth, other possible causes of a salty taste in your mouth include certain medications, acid reflux, and nasal allergies. If you're experiencing a chronic salty taste in your mouth, it is best to consult with your doctor to rule out any underlying medical conditions. Number 5, cold sores and cuts. Have you ever noticed a cold sore or a cut in your mouth that doesn't really quite seem to go away? Well, this can be another way that diabetes may affect your mouth. Now, poor control of blood sugar can keep injuries from healing quickly, and diabetic tongue may make it more difficult to avoid cuts or scrapes in the first place. In addition, diabetes may cause changes in the tissues of the mouth, making them more susceptible to infection. So, if you have diabetes, be sure to take good care of your mouth and see your dentist regularly. So, that's it for today. Please make sure to share your experience about this topic, and remember to like and share this video with the family and friends. Remember, we have hundreds of videos. All you need to do is to add SugarMD keyword while you're searching for something, anywhere. It could be a blog or it could be a video. Thank you for watching. We'll see you next time. Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it. And if you did, watch this video right there. I think that will help you too.